We're creating a recording of a pharmacy students creating a medication reconciliation as part of an interprofessional training project where we are going to be helping other professions learn how to perform a medication reconciliation. A pharmacist has special training that view medications in a slightly different way than other healthcare professions, and the approach that a pharmacist takes when reviewing medications are helpful for all professions to see how to approach a medication reconciliation. And there are various tips to consider before performing one.
So a helpful tip that we would like to talk about is making sure you're asking the patient what the name of the medication is that they're taking, what they're actually taking it for, and also determining the serving size, so how much they're actually taking. So a nice example to look out for is when you're looking at the supplement facts, the serving sizes can vary. So it's important to ask the patient, how many capsules are you taking a day? And so if the patient says, for example, I'm taking 500 milligrams, it's important to look because sometimes 2 capsules could equal 500 milligrams. So the patient might not understand that, oh, 1 capsule does not equal 500 milligrams. So instead that they're actually taking 250, not the desired dose of 500 milligrams, which is 2 capsules. So it's important to determine how much that patient is actually taking and what the amount per serving actually is. Another good tip is to determine if a patient is taking additional supplements because sometimes there can be overlap with the amount of vitamins that could be in those supplements. So we want to make sure that we calculate that and determine possible overdose of vitamins to make sure the patient is safe.
And another thing you want to be aware of when you're doing these medication reconciliations is to allow the patient to kind of be in control of the conversation. And that's why open-ended questions are really important because this allows the patient to just be open about their routine with the medications, how often they're taking it, are they being adherent with their medications, etc. And that gives you more of a full picture of it rather than you putting words into their mouths. And so just being open with them, it allows you to get a fuller picture and to give better recommendations to the patient.
In addition, PRN is often noted in the EMR, but there is no notation on how frequently the patient is actually taking it. So in the example we have here, the patient says PRN and the pharmacist asks specifically how many times per week are you taking it.
Hello everyone, we are third-year pharmacy students at the Ernest Meyer School of Pharmacy at Rutgers University, and today we're going to be completing a medication reconciliation. Today I'll be acting as the pharmacist.
And I'm going to be a 65-year-old man who's coming in after a car accident. I've experienced a concussion, and these are just after I've kind of recovered a little bit and I've started some medications for it.
Okay, sounds good. Okay, welcome in. So today, Dr. Jones wanted me to speak with you as a pre-visit, just to go over some of the medications that you're taking. He did say that you just had a car accident and you're experiencing some symptoms. Mm-hmm. So I thought it'd be a great time to do a medication reconciliation, just to go over the medications you're currently taking and how you're doing with them. Sounds good?
Sure, yeah.
Okay, so I see that you brought in a nice bag with a lot of medications in it. How about you go ahead and pull out one medication at a time, and then we can just discuss it.
Sure. So I'm on a couple prescription medications. Okay. One of them is actually this omeprazole I'm on, and this one I've actually been on for a few years now. I experienced GERD. I was diagnosed with that a few years ago, and that's when I got this medication. Been kind of trying to come off of this medication actually, but every time I've tried it, the GERD just kind of comes back, and so I just kind of go back to this medication.
Okay, sounds good. Let me just take a look. So yeah, this is omeprazole. Okay. I do see that. And you did say, how did you take it?
I take it according to the directions. Okay. I take it every day.
Okay, sounds good. So with this medication, we do advise that patients shouldn't be taking it for a long time. So that's something I'm going to be noting down in your patient profile for Dr. Jones to speak about some possible alternatives and possibly getting you off the omeprazole. Okay. And also with this medication, we do see that it actually increases risk of bone loss. So that's something that I'm also going to jot down here for Dr. Jones to take a look at for potential alternatives.
Okay. Yeah, thank you.
Mm-hmm. What else?
I also take, this is another one of my prescriptions. This is actually citalopram. Okay. This one I actually recently started, and Dr. Jones, he told me, he prescribed me this actually after my accident, and just told me that some of my mood swings could be because of the accident, so this is supposed to just short course of it. It should help with just managing the mood swings.
Yeah, I do see this is a citalopram 10 milligram tablet. Yeah, with this medication, we do see actually that it could increase fall risk. So that is something to jot down here in your patient profile, just because after this accident and increased risk of osteoporosis, we do see increased fall risk, and that's something that we do want to watch out for. So that's something I'm going to also jot down here in your patient profile.
Great, yeah. Okay, yeah, so I guess another medication that I take somewhat regularly, but not too often, is Benadryl.
Okay.
I've been more taking it with sleep issues that I've been having actually, because it just helps me sleep ever since the car accident. Sometimes I've been having trouble at night sleeping, so yeah, I take it occasionally.
So you take it occasionally. Would you say like in a week, how often do you take it?
Maybe like 2 or 3 times a week.
All right. So with Benadryl, this is an antihistamine, so this actually increases risk of fall. Have you been experiencing any like unsteadiness recently?
Yeah, actually, after this medication and with like maybe even just like some of the added ones too, I've just been feeling a little bit of balance issues. Going up and down the stairs has kind of been a little bit scary, and so I'm a little bit afraid of falling, and so yeah, maybe I should talk to Dr. Jones about that.
And I'll definitely jot that down for him to discuss possible alternatives, just to help with the sleeping issues, and again, decreasing our risk for falls for you. Okay?
Yeah,
Sounds
absolutely.
good. All right. What else do you have there for us?
So these next ones, these are just my vitamins, not exactly prescription medications, but I just see I've got calcium here. I just have some vitamin D, some magnesium, some vitamin K as well.
All right, that's good. So tell me a little bit about how you got this collection of vitamins and just supplements, and how did you get to that point?
Yeah, so these ones actually mostly started all of them kind of together ever since the car accident. Talking with Dr. Jones, he said that once you break a bone, once you kind of get into that, you might have further risk of like breaking bones in the future and more for like fall risk and everything. And so just kind of being afraid of that a little bit. And so when doing my own research online, I saw that vitamins are a good way to just help with your bone health. And so these were just 4 of the ones that I kept seeing popping up. And so I decided to start a couple of them.
Well, you did some good research, because these are all great for bones. You have vitamin K here, magnesium, vitamin D3, and calcium. So these are all really helpful for bones. So good job with that. Just one thing I did want to point out with the vitamin D, it's really important to get like a vitamin D concentration test done, just to see how well our blood is actually absorbing the vitamin D. So that's something I'm going to jot down for Dr. Jones to take a look at. Usually a level that we look for, a range of concentration, is 30 to 50.
Sure.
So that's something I'm going to see if we could get done for you, and just to see further action with the vitamin D and the kind of concentrations that you would be needing. Okay,
yeah,
sounds good.
That sounds good.
All right, so thank you so much for coming in today. Do you have any questions for me?
I don't think so. That was all very clear. Thank you.
Okay, great. That sounds good. I'll let Dr. Jones know that we're ready to see him.
All right, awesome.